Did you know that in North Carolina, 12 people die every single day from an overdose? That is 4,380 people a year in North Carolina alone. And 77% of those overdose deaths involve fentanyl. Hi, I'm Christy Tomadjewitz. I'm a recovering addict. And today, I'm going to tell you why North Carolina would benefit from drug overdose prevention centers. When I am finished, you should be able to understand why North Carolina would benefit from those drug overdose prevention centers. According to the Drug Alliance online at www.drugpolicy.org, there are close to 200 overdose prevention centers in 14 countries. There are only 2 here in the United States, and they're located in New York City. The third one in the U.S. is supposed to open in the year of 2024 in Rhode Island. Did you know that 64% of Americans voted for overdose prevention centers? So, some of the biggest barriers that overdose drug prevention centers face is politics, funding, and space to open the centers. Most federal and local lawmakers don't want to be the first to welcome an overdose prevention center into their community. And honestly, some of those communities have that not in my backyard stigma, which means they're not very open to having overdose drug prevention centers in their backyards. And for lots of reasons. They feel like it's going to bring more traffic into their neighborhood. It's going to bring a negative light. The funding is not there most of the time, even here in North Carolina. Now, North Carolina does receive a grant every year for drug prevention and overdose prevention. And it usually rounds about $939,000 a year. And sometimes they get a little more if the crisis in North Carolina of overdoses is higher than normal. What are we doing with those benefits here in North Carolina? We're using it to buy Narcan. We're using it to have portable portable crisis centers. And they travel from community to community. But you're only able to reach one community with portable crisis centers. And if we opened up overdose drug prevention centers in North Carolina, in multiple counties, there are lots of factors that would benefit us. It reduces the risk of overdose deaths. No one should die alone from an overdose. Reduces risky behaviors associated with HIV and hepatitis. It lessens the spread. Reduces public disorder and drug use in public. It also reduces overdosing in public. Decreases the participants' chances of being physically assaulted or sexually assaulted. Saves money in the community by reducing the use of emergency personnel and health services, which means it won't be so much on our emergency rooms. It won't be so much on our doctors. Increases the chance for addicts to get better and sober. Most people that go to overdose prevention centers are usually led to sobriety because they have more benefits. There's ways to test the drugs and make sure there's no fentanyl in them. You have someone there who cares enough to make sure that you do not OD. Now that I've come to the end of this informative presentation, I hope that you will be able to explain why North Carolina would benefit from overdose drug prevention centers. Since 2020, 36,000 North Carolinians have died from drug overdoses. And the overdose rate in North Carolina alone has jumped 93%. North Carolina would benefit greatly from overdose drug prevention centers, and it would help save lives.